Welcome to yet another edition of our special coverage on COVID-19. I'm Min Son-hee. Today marks 100 days since the World Health Organization was informed about the first case of COVID-19. The virus has since infected nearly 1.5 million people across the globe. In today's coverage, we touch upon Korea's efforts to share its tackling of the pandemic with its global partners. But first, here are the headlines for today with our Kwon So-ah and Noaram. Welcome.
Hi.
So we'll start with you. The numbers we've seen in the domestic front are by far the lowest today.
Exactly. We had 39 cases today, so below 40. That's a number we're seeing for the first time in around 50 days. And that's ever since the 31st patient, who's also known as the super spreader and who was believed to have caused the massive group infection in the Daegu and Gyeongsang-buk-do province region. But now, if we take a look at our map, only 4 new cases we're seeing in Daegu and 0 in Gyeongsang-buk-do. But a dozen new infections in the capital Seoul and 10 in nearby Gyeonggi-do province. Now, with that, the total number of cases is tallied at 10,423, and 4 more patients died. They were in their 80s and 90s. Almost 200 people, meanwhile, recovered in the past 24 hours.
Right, but I understand imported cases remain a concern here.
Right. Well, recently we've been seeing that around half of our cases were cases from abroad. But now today we're seeing with the overall drop in cases that the number of imported cases has actually surpassed the number of domestically infected cases. Now 23 out of the total 39 contractions were reportedly imported cases. Authorities stressed that we will have to wait for the incubation period, known to be around 14 days to be over, to get the exact number of cases among people who entered the country before April 1st, because that's the date when South Korea strengthened its entrance measures by requesting a 14-day self-quarantine for anyone arriving from abroad. Meanwhile, the government vowed to do their best in treating COVID-19 patients from abroad, no matter whether they are Korean nationals or foreigners. Meanwhile, more than a dozen foreigners that tested positive for the virus but had relatively light symptoms, they are being treated at a community treatment center in Paju in Gyeonggi-do province. And I just wanted to share a touching story there because 2 foreigners have recently been discharged from that center, and including 1 Chinese person. And that person made a donation through to the South Korean Red Cross to help other people being treated here in the country.
Oh, that was very good on her. I understand COVID-19 is aggravating food shortages worldwide.
Right, that's according to the United Nations World Food Program, which designated 49 countries that are expected to be worst affected when it comes to food shortage issues arising from the pandemic. And North Korea is among those countries where, according to data, some 12 million people are suffering from food shortage and malnutrition. According to a report by the World Food Program on the potential impacts of COVID-19 on the poorest people in the world, more than 210 million people are suffering from chronic food shortage, while 95 million are suffering from severe food shortage. It also mentioned 33 countries in Africa and the Middle East, 8 in Asia, including North Korea, where disruptions in farming and trade are expected to worsen food supply. Now, let's shift to our daily updates around the world. The U.S. now has more than 420,000 total cases, over 14,000 deaths. And Spain's death toll on Wednesday surged again after recently appearing to see a decline. And France has become the next country with more infections than China. And those are the global updates.
All right, Sua, thank you for that.
Thank you.
Aram, schools have started here in Korea, albeit online.
That's right. And middle and high school seniors were the first to undertake these online classes. They were conducted in 3 forms. The first is interactive lessons with the teachers in real time. The second is pre-recorded lectures from national education broadcasters or the teachers themselves. And the third was handing out and assessing assignments in the late afternoon, which they're probably doing now as we speak. However, despite the virtual classes, there are concerns that social distancing practices practices could be jeopardized. Although students are learning mostly at home, there is a chance that students will congregate more now since the schools have opened and there's more chance for interaction. Schools can stop gatherings on campus, but they can't really do much when students are congregating or gathering outside of school grounds. And especially in Korea, since students go to private education institutions and private academies after school, there are concerns of cluster infections in these places as well. Therefore, authorities are urging private academies to adhere to the COVID-19 measures, such as keeping students at least 1 to 2 meters apart from each other, as well as wearing face masks during class as well. The first 2 days will focus mainly on getting used to the new system because it is a first in the history of the country, and not just for students but teachers as well. It's a learning process for them as well, and also for especially low-income households, students who may not have these electronic devices needed for the education, such as PCs or laptops. The schools will lend them. I think the government has distributed about 320,000 of these electronic devices to hand out students in low-income families.
Right, that is good to hear. Now, the pandemic has dealt a huge blow to global trade, and I understand you have some alarming figures from the World Trade Organization.
That's right. The WTO says the decline in world trade due to COVID-19 will likely exceed the trade slump brought by the global financial crisis that we saw more than a decade ago. The organization forecasts global merchandise trade to fall by 13 to 32% this year. The reason for the wide range is because there's still so much uncertainty surrounding the economic impact of COVID-19. The organization also noted that we could see a rebound next year provided that countries work together. The WTO chief said keeping markets open and predictable would be critical to spurring renewed investment. Services are not included in the grim forecast, however, but the WTO said trade in this area may be actually hit the hardest by COVID-19 because of these transport and travel restrictions that we've been seeing. Trade had already actually been slowing before the COVID-19 outbreak, mostly due to trade tensions between the US and China.
Numbers for the job market are equally as grim.
That's right. The International Labour Organization says 81% of the global workforce, that accounts to about 2.6 billion people, are currently affected by full or partial workplace closures. The ILO described it as the worst labour market crisis since World War II. The ILO also expects that 6.7% of working hours globally will be wiped out in the second quarter of this year, equivalent to the labour of 195 million full-time workers based on a 48-hour work week. Retail, manufacturing and hospitality, which account for around 38% of the global workforce, are among the most vulnerable sectors.
Now, most of the people who've lost their lives because of COVID-19 have been those with prior health conditions. But I hear there's a report that shows young people are also at risk.
Yeah, they're certainly not out of the woods. According to a Washington Post analysis of state data, nearly 760 people under the age of 50 have actually died from COVID-19 in the United States. Among them were 9 people under the age of 20, in fact. And the Post found that at least 45 deaths came from people in their 20s, at least 190 deaths among people in their 30s, and at least 413 deaths among people in their 40s. The paper also noted that the death toll could actually be higher as some states are not included in that Washington Post report. The largest proportion of young deaths came from New York, the epicenter of the outbreak in America. Although most of these young people did not have underlying illnesses, some of them didn't, which is a cause for concern as well. And experts are particularly puzzled over the randomness over these types of deaths in young people who are unable to fight the disease. They say a healthy athlete could just be as vulnerable as someone who maybe doesn't exercise at all during their lifetime. And we've seen such cases in Korea as well. A couple of people in their 20s also died here in the country due to complications from the virus. Although their official cause of death wasn't cited as COVID-19, there is something known as cytokine storm, which has been blamed as a possible cause for the deaths in these young people. This is when certain patients' immune systems kind of overreact to the virus, sometimes in a lethal way, with the lungs inflaming and fluid building up as well, which could prove fatal. But more studies need to be done on that front.
Right, okay. Aram, thank you for that. So thank you. We'll see you again tomorrow. It's time now to join the Central Disaster and Safety Countermeasure Headquarters for the regular briefing. As our Konsoa reported earlier, the number of new infections has dropped here in Korea. And one piece of relatively promising news is that Daegu only saw 4 new cases today. Here now is the briefing.
오늘 배석은 진단검사의학회 전문가 3분, 연세대 의대 이형민 교수.
Today we also have medical experts here at the briefing, including professors from the Yonsei Hospital as well as other hospitals. But first, here is Director Chung Eun-kyung with the briefing. Let us now begin our regular briefing for April 9th, Thursday, on the coronavirus outbreak. As of today, the total number of confirmed cases stands at 10,423. This includes 861 imported cases from overseas, and 92% of them were Korean nationals. Yesterday, 197 more people have been discharged after full recovery, and the total stands at 6,973, or 66.9% of the total. And we had 39 more confirmed patients yesterday and 4 more fatalities. And the death toll now stands at 204. I said my deepest condolences to those who have passed away, as well as their bereaved families. And the regional breakdown of the confirmed cases, please refer to the table with you. And yesterday, about 80% of the outbreak was related to cluster infections, and 9% of the cases are under investigation. And 12 new cases were reported at the city of Seoul, and a majority of them were related to imported cases. And we also had new cases of the nightlife venues. And in Daegu, we had 4 cases centering around the nursing hospitals. And in Gyeonggi-do province, there were 10 new cases. There were 5 imported cases, as well as some cases related to the St. Mary's Hospital. And yesterday at the airport quarantine, we had 10 more cases reported. And yesterday we had 23 imported cases, and by country, 16 were from the US and 15 were from Europe. And we have a total of 861 imported cases. And among the 8% are foreigners. And in Seochogu district, centering around a bar, we also have 4 confirmed cases so far, and we're conducting investigative research. And also we have 4 more confirmed cases at a wine bar at Pyeongtaek City, and we have 17 confirmed case total. And we also have 2 cases that have been reported at a nightlife entertainment venue in Gangnam-gu district. And considering the enclosed feature of these venues, it is very highly contagious. So we would also like to urge that these venues need to go on closures for the time being. And if they need to be open for necessary reasons, they need to abide by the government guidelines for quarantine. And the KCDC is also considering the monitoring of the latest transformation of the genes in the coronavirus. And we have also identified and analyzed the 73 virus genes collected from the confirmed cases, and we have not yet figured out a significant meaning behind this. And currently we are trying to enhance the effectiveness, and we have laid out a special protocol for the investigation. And this includes a combination of different samples and combining it to one so that we can carry out analysis. And this will also be very effective for identifying the samples for those who have no symptoms. And in light of the increase of the imported cases, the KCDC is also carrying out enhanced self-quarantine measures for those who are flying in from overseas. And about 47 of the total confirmed cases were reported were regarding the imported cases. And as for these people, we also advise they to use their own utensils and they do not share the utensils with their family members. And from the April 9th, we also confirmed 143 people who were related to the imported cases, and 20% of them were related to family infections, and 20% to friends, and the rest of the 10% were related to the workplace infections. And we also have heightened measures for those who fail to comply with the self-quarantine regulations, and they will be subject to imprisonment up to 1 year or fine up to 10 million won starting from April 5th. We also urge the public to participate in enhanced social distancing campaign, and we also advise the public to refrain from attending in closed-door facilities that are crowded. And we also ask every one of you to maintain good personal hygiene, including washing hands and covering while sneezing and coughing. And if you feel sick, please stay home for the next 3 to 4 days and monitor your conditions. If your symptoms continue, please go to the screening centers to get testing, and please secure 2 meters in between of the distance while you meet others. Thank you very much.
권계철 대한진단검사의학회 이사장의 진단.
Right, that was the regular briefing by the Central Disaster and Safety Countermeasure Headquarters. Korea has recorded 39 new cases, raising the total number of infections here to 10,423. Now, we started the weekday on Monday with 47 cases, followed by that same number on Tuesday. Then on Wednesday, we saw a slight increase with 53 cases, and today we've marked a slight drop to 39 cases. Now, as authorities have stressed again and again, concerns over cluster infections remain. So people are being asked to continue abiding by the social distancing campaign until the 19th of April. Now, COVID-19 has brought quite a number of foreign journalists into Korea, especially those interested in covering Korea's response to the pandemic. To learn more about this, we have Jeremy André, a correspondent for Le Point of France, live on the line. Hello, Jeremy.
Hello.
Now, I understand you were scheduled to leave home, to head home, that is, in mid-March, but you were not able to do so. Please tell us why.
So I came mid-March to cover the COVID-19 response here in Korea. And so after a week of report, we decided to get tested in an hospital to be sure that we had not been infected during our report. My photographer and Charlene Flores tested positive. So,
Jeremy, we're not hearing you very well. Could you speak perhaps a little bit louder for us?
Yes, yeah. So the photographer I was with got tested positive, and she was sent to the hospital, and I was isolated in a hotel as a contact of the infected index patient.
I see. So after a week of your coverage, you were tested, both you and your colleague, your photographer, you said, you were tested for COVID-19 and she tested positive. Have you been in contact with her, perhaps online, over the phone? How is she doing? Do you know?
She's doing perfectly fine. She had only very mild symptoms, and the hospital staff was really nice with her, and she went out of the hospital on Monday after 2 negative tests following the procedure, and actually saw her from my window as she came on Tuesday to just wave at me.
Okay, that is great to hear. But you are still in self-isolation. Today is your last day of quarantine, is that correct?
Yes, exactly. So,
Jeremy, what was the whole experience like?
It was good. I think it's a very special procedure, and it can be very stressful, but the public health center organize it so it's less stressful, and they explain you everything. When you arrive, there is papers with instructions and even gift, food, just to ease the situation.
Nice.
Then I would say that maybe after a week you start to feel lonely, and anyone would like to socialize, but I think it's a good procedure because only a minority is isolated while the rest of the population can go out freely.
Right. Jeremy, those under self-isolation in Korea are expected to download a self-quarantine app. In your opinion, how effective is this app in curbing the spread of the virus?
I was not invited to install this app, and like 1/3 of the people actually in self-isolation, I didn't use the app. But I think this app can help the public health centers to monitor the people under self-isolation and avoid people breaching their quarantine by just self-discipline and not through the threat of fines or going to jail. And I think it's really better that there is this kind of app that can help the people to self-discipline.
There is concern, Jeremy, within the foreign media that the COVID-19 emergency measures in Korea could lead to a violation of privacy and personal freedom. What are your thoughts?
I think there is a huge misunderstanding in Western countries about the Korean strategy that is actually for especially European people compared to the mass surveillance used in China, and it's not at all the same. The tracing in Korea is targeted and limited to index patients and their previous contacts. And it's not a surveillance that is for all the population. And that's a huge difference. But there is still an issue, that's the issue of the quarantines, because the quarantines are a restriction of mobility and freedom. And so it should be very, it should be decided only with democratic and medical control to impose this kind of quarantines. But the KCDC has this kind of control and is not making this kind of decision lightly.
Jeremy, you've covered Korea's response to COVID-19 firsthand, including its testing centers and disinfection efforts. What are some of your key takeaways from this?
Actually, someone told me something very true about COVID-19, Korean strategy. It is not rocket science. It's not very advanced technology. It actually depends a lot more on the efficiency of institutions like the KCDC, and also the strong will of the government who took it very seriously from the beginning. And I think it's the main mistake that we did in Western countries. We didn't take it seriously, and we didn't prepare and add this kind of institution that had a plan to fight this kind of pandemic.
I see. Well, the situation in France and your country is also looking quite grim, Jeremy. What are your future plans with regard to your coverage of the COVID-19 pandemic now?
I'm going back to my home that is in Hong Kong tomorrow, and I think I will keep following the news from here in Asia. In France, the situation is very grim, and we don't know where it's going in Europe. We were expecting to go past the peak of the epidemic during the past week, but we didn't manage to flatten the curve. So there is really a big question mark on what's going to happen next in Europe.
Right, only time will tell. All right, Jeremy, thank you very much for sharing your thoughts with us. We look forward to seeing more of your reports in the future.
Thanks.
South Korea has emerged as a model to emulate in the fight against COVID-19 following its success in early detection and containment of the virus.
연대와 협력만이 코로나19 극복의 답입니다.
The South Korean government was asked by the World Bank to share lessons learned from the COVID-19 outbreak with developing countries that are vulnerable to health crises. In response, the Ministry of Economy and Finance published and distributed an English booklet on the country's response to the pandemic. We take a closer look at South Korea's commitment to transparency and aggressive testing and contact tracing and how it helped flatten the curve.
A growing number of countries are looking to Korea's strategy in flattening the coronavirus curve. Accordingly, the government is sharing its response tools to help developing countries contain the pandemic. For more on this, we have Lee Dae-jung, head of the Development Finance Division at the Ministry of Economy and Finance, who oversaw that particular project. Welcome to the studio.
Well, thank you for the invitation.
Now, I understand the Ministry of Economy and Finance has published a booklet titled Tackling COVID-19. Could you tell us a bit more about this project?
Okay, well, on March 25th, the World Bank Vice President Mokhtar Diop, who is in charge of the infrastructure, requested Korean government to share the information on the COVID-19 response. And he asked specifically on the strategy and also the toolkit the Korean government to undertake. And he explained that it will be very important information to share with the developing country in need. In response, our ministry published a booklet containing the Korean government's health, quarantine, and also the economic measure called Tackling the COVID-19 through the intergovernmental cooperation with the Ministry of Health and also the Korean Center for Disease and Control and Prevention.
I see. What kind of information can we expect to see in this booklet?
The booklet contained the first current status of the spread of the virus and also the healthcare and quarantine measure, as well as a national economic response in fight the COVID-19. And we obtained the detailed material and information from each government ministries and agency in charge of COVID-19 in collaboration with the different ministries and agencies. While we are complying the booklet, we're focusing on the two things. First thing is testing the coronavirus and also the epidemiological surveillance of a confirmed patient.
I see. The World Bank initially simply asked to use Korea's ICT system, but you decided to provide them with a more detailed, comprehensive booklet. Why?
That is a very good question. Our booklet titled Tackling the COVID-19 critically targeted not for the ordinary citizen and people, and in fact it targeted for the healthcare profession and also the Medicare and medical officials around the world. For them, thorough and professional information is very useful rather than the fragmented information. Coronavirus known has no border. It doesn't have discriminate the nation, and it doesn't discriminate the people of color. The bottom line is the coronavirus response is not about the crafting policy measure, but also about how many lives we can save. We wrote the literature with the utmost purpose of conveying the comprehensive information to the developing country as well as the developed country so that they can also flatten the curve of the virus. And then this all comes down to the saving life in those countries in need.
You mentioned this yourself as well, but the booklet was initially for developing countries, but you've also given it to the US, China, and European countries. Why?
Well, as currently, when we first released it, the World Bank has 189 member countries. So when we sent it out to the World Bank, we also sent it out other developing country, ADBs and the African Development Bank and the IDB in charge of Latin America. So it's a pandemic of the COVID-19. This is not only an issue of one country or one continent, it's a global issue. And as many other countries are struggling to fight against COVID-19, and the Korean Express is really important because it's not only the public data should be available to the one country. This is important, the public data should be shared with the global community. And this is in a position of the government, and we continue to enhance our effort to share the information. And we share the information with also the Korean embassy in overseas. And when we share this information to the Washington, and the ambassador really appreciated the details and comprehensiveness of the information, and he requests to share with the people who was working at the U.S. Congress, and also the Washington Post and other media, as well as the key think tank in Washington, D.C., like the Brookings and the Peterson Institute.
Apart from the response from our ambassador and the U.S., what has the response been like from the World Bank and other countries that received your booklet?
Well, immediately after the World Bank, I think there was quite a heat and competition for to get the booklet, and we have received many emails requesting whether we could share with the other constitution of World Bank and other institutions. And several and many companies and also the academia showed interest in the booklet and wish to share further with their countries and the institution. And the demand of the booklet was especially high in the developing country, and which demonstrate high level of interest of Korea's healthcare measure against the COVID-19. And at the same time, I was very surprised to inform that the US and Germany and France and China and Spain has a keen interest of a booklet and the request of a special talk with some of the countries have requested special talk with the Korean government. And finally, fortunately, we have slowed down the spread of COVID-19 in Korea, but it is not over yet. So government will continue to update the information and data for the future action to share it with the international community through our responsibility of to the global society.
Is there a way of simply downloading this booklet online?
Okay, the information is uploaded on the ministry website, and you could click search the Ministry of Economy and Finance, and their English page, we have a pop-up. So if you click on it, and you could download it, and please do share with as many people as possible.
Oh, that would be very convenient then. What other measures are being discussed at the ministry to perhaps assist countries fight the pandemic?
I think that is also a good question. The Korean government will work to provide a comprehensive package to developing country, covering from the healthcare and hygiene to disease prevention through the many available channels. We are currently developing anti-epidemic project model with the developing agency like World Bank and ADBs. And we also have a plan to share the more detailed information about how the Korea fight it, and using the YouTube, also the material. And we are in the stage of making another booklet on how the Korea fight the pandemic of COVID-19 using the high-tech and ICT technology.
I see. Now, one more question, but this one's for our country, of course. We understand the government has come up with a stimulus package to ease the economic fallout from COVID-19 for us here in Korea. Could you tell us a bit about that? Yeah, I think that's another important thing, and many of the audience and the people around the world are keenly interested. And the COVID-19 is a healthcare and quarantine issue, but at the end, it affects the lives and peoples of working people. So in addition to the health measure, in Korean government taking the various fiscal, tax incentive, and financial stimulus package program,
And currently, this is about the size of $11 billion US, and we have already unveiled. And in addition to that, we have announced an emergency support measure to stabilize the livelihood of the vulnerable people, and which amount to about $9 billion US. Government will focusing on the economic support, on the first helping the small and the self-employed business, and also second, helping the marginalized firm in the small side, and third, providing the wage support to help the business to maintain the job security to those employees.
I see. Well, we have medical experts fighting the COVID-19 on the front lines, and we have government officials like you in the back supporting them. Hopefully this will end soon. Thank you for your time here.
Thank you.
In this next segment, we stay with Korea's efforts to share its strategy against COVID-19 with the international community. For more on this, we have Morten Larsen, a freelance journalist from Denmark, here in the studio with us. Welcome, Morten.
Thank you very much.
Let's begin with the latest in Denmark. I understand there are plans to ease movement restrictions there. Is it safe to assume that numbers are on a decline?
It's never 100% sure, of course, but so in Denmark, the way they tally the numbers is slightly different. They measure in amount of people hospitalized. And that number has shown a slow but steady decline over the past few days. And so based on this, the government assumes that we can now slowly, very slowly, start to opening up the country a little bit more. But there has been, that decision has been met with increased concerns from some groups in Denmark that it is too early, that we still need to restrict movement and we still need to practice social distancing.
Are these groups medical experts then?
No, this is the general public. This is parents, this is the elderly, this is people who might be immunocompromised in one way or another, but it is the general public.
I see. Now, like you mentioned, Danish Prime Minister Mette Frederiksen has announced that the opening will be gradual, it will be quiet, it will be controlled. How does she expect to manage this?
So the government made up 3 different plans to open up. They had the big opening up, which allowed for bars, restaurants, private workplaces, the government workplaces to open up. And then there's the medium one, which restricted still bars and restaurants, but allowed, for example, hairdressers to start working again. And then there's this small one, which is basically only schools are opening up for the younger kids, the younger classes. And that's the one they went with. They chose the most conservative one, the most secure one, so to speak. So it is young children who will now be allowed to go back to school. And private companies can start working again if they implement social distancing in the workplace, meaning 2 meters apart, for example. So it is a very gradual one, and that has also met some complaints. For example, hairdressers argue that they should be able to open up because they can practice social distancing at their workplace, but that has been declined. So if you work, for example, at your laptop, you can go to work at your office, but sit apart, but hairdressers cannot.
Oh, I see. So Italy and Spain have seen drops in their number of new infections, but this has not been the case for France. These are neighboring countries, of course, to Denmark. There are some, therefore, who say that it's too early to lift these movement restrictions. What are your thoughts?
I definitely see the argument in it being too early to lift restriction of movement, but I do believe that based on what we've seen here in Korea, for example, that you can have a population that practices social distancing without implementing government lockdown or government mandated movement restrictions. It can still function and have a controlled spread. So I do actually believe that we need to slowly open up a bit more, as we've seen in Denmark. Also just for the sake of mental health for a lot of people, because it is straining in the long run to be on lockdown. So I think if as long as the populations keep practicing social distancing as best they can, wash their hands and as best as possible avoid going out, I do think that it is better to begin opening up.
Morten, it's really interesting how you mentioned the psychological impact of COVID-19. That's something we'll be covering tomorrow.
Oh yeah.
Right now, what is the Danish public's response perhaps to Korea's handling of COVID-19?
It's been a very, very big interest in the way Korea have done things, because Denmark was one of the first countries to, for example, shut its borders. Like almost immediately someone started coughing, we decided to close the border. And that the fact that Korea had stayed open and allowed people to come in under restrictions given has been very interesting, and a lot of people have looked over here to be like, how can we do it? And I know our Prime Minister Mette Frederiksen gave a call to President Moon last week, I believe, to ask questions, ask questions about testing kits and gain some sort of like expertise to like how can we progress with this slowly opening up of our society. So definitely there's been a lot of interest.
You mentioned the testing kits. Now there's been a huge surge for Korea's testing kits worldwide. Do you believe there's valid reason for this demand?
I mean, it's partly due to Korea has been highlighted by the WHO as the golden standard, so to speak, with aggressive testing. That has, of course, given a lot of branding effect to Korean test kits. But I do also believe there's been some reports of Chinese health kits or Chinese masks, I believe it actually also was, not having the quality that was desired. And I think maybe Korean test kits have not had that problem yet. So there is a branding from the WHO, from the global media, people like myself who've been talking about how well it's done here, how the testing has been very successful. So there's been a global interest due to that. And I can't talk about the efficacy of the tests because I don't know enough about that. But I do believe I mean, the success speaks for itself.
Right. Staying with the testing kits, Korea's aggressive mass testing would not have been possible without its original diagnostic technique. Now, this technique embedded in COVID test kits, currently in use here, could soon become a global standard, like our Morten just said. We have more in this following report.
South Korea has been praised globally for its swift and coordinated response to COVID-19. According to the Ministry of Foreign Affairs, 90 countries have asked South Korea to export medical supplies, including test kits. If the requests made through civil channels are taken into account, the number rises to 121. The sheer number of requests suggests that South Korea is increasingly being viewed as a model to emulate. The country is also taking the lead in setting the international standards for diagnosing various infectious diseases. South Korea's standard for real-time polymerase chain reactions, or RT-PCR, has been approved by the International Standard Organization as a draft international standard. What does the standard entail?
Yeah, the standard defines the entire procedure and method for nucleic acid amplification-based examination for detection of microbial pathogens with a laboratory quality practice guide. This standard is applicable to various nucleic acid amplification testing, including real-time polymerase chain reaction methods, like the ones used in the COVID-19 test in Korea.
International standardization is a long and complicated process.
Yeah, the standard was first proposed by the MFDS expert committee in 2016. And the standard proposed as a New York item proposal was reviewed by the technical committee composed of international experts. and was reviewed to be approved as working draft, committee draft, and then the draft international standard. And the applicable technical committee on in vitro diagnostic test systems has been developing the standard with 67 members. And the standard has been approved as DIS with no objections in this February through 4 years of effort.
For the past 10 years, the Ministry of Food and Drug Safety has worked with the Korean Agency for Technology and Standards, as well as private sector businesses, to develop an effective diagnostic method.
Actually, it is very, very meaningful that the MFDS and CATCH have developed the infectious disease diagnosis technique and have led the international standardization where the Korea's capability of testing for COVID-19 has garnered considerable attention.
So what does the latest approval mean for South Korean businesses producing diagnostic test kits?
Yeah, the approval of standard will reinforce the international community's trust in Korean diagnostic test kits for infectious diseases. So the local companies can expand their business into the global market, and we can save more people with a timely manner.
We hope South Korea's advanced diagnostic technique will help healthcare professionals around the world stay ahead in the fight against infectious diseases.
Now, Morten, Denmark asked for Korea's testing kits after an initial decline to a request that Seoul made first. What was the reaction like then?
It was a bit of a scandal because when it came out that Korea had offered testing kits, and the Danish government just didn't accept it, move on it, and then it came out in the media, and people were quite furious because at this time it was in the early stages of the epidemic, and at this point Korea was already starting to get a lot of praise. So a lot of people were looking to get something that could improve the situation in Denmark, and so it was quite of a big scandal, and people were mad at the government and the authorities, and that prompted them to have to reach out back to Korea and say, like, we really do want those test kits.
Right, and you will hopefully get them soon.
Yes.
All right, Morten, thank you again for sharing your thoughts with us. Now, meanwhile, here's some information for those interested in purchasing Korea's diagnostic products, including test kits. For governments, a formal request to Seoul's foreign ministry will be forwarded to local companies. For private firms, there is a list of suppliers approved by the Ministry of Food and Drug Safety available on the Medical Device Industry Information Center website. And that is all the time we have for today. Do join us tomorrow at this hour for more on COVID-19, including the story of healthcare workers in New York and the growing number of people experiencing the psychological impact of the coronavirus. In the meantime, do share your thoughts and inquiries with us through our social media accounts. Thank you for watching.